Okay. So, in any case, I just gave a bit of a background with regard to my education and credentials, and so, what would you like to ask me?
Well, I can, but I don't know if I'm hearing a 20-second delay or we're live. No, I got all of that. Can you hear me?
Yes, I can. I can hear you.
Well, I don't quite understand. Well, I think I'd love to go through your letter, because what we've got here, boy, I hear the double talk back, so I don't know how we're going to communicate here, Dennis, but you've done a wonderful job in writing a letter to the Premier. I understand the Western Standard that this has been the most viewed article that they've ever put out, over 600,000 views, I don't know, a couple of days ago there, but you started off your letter to the Premier by referring to the fact that, and he's saying that the number one reason for all these shutdowns and lockdowns is because we can't overwhelm our healthcare system. You've got a lot of experience in that. You wrote about that. Maybe talk a little bit about whether or not our healthcare system is being overwhelmed and what should perhaps be done with that.
Sure. Well, remember that there is medical nursing staff and other support staff that look after the entire hospital population. And in general, the ICUs run close to capacity, dealing with the normal sorts of problems that show up in general systems, intensive care units, burn units, cardiovascular intensive care units, et cetera, cardiology intensive care units as well. So the staff is there to look after those people. Now, if those people are replaced by another type of individual with another type of problem, in this case, COVID-19, the staff is still there to look after them. When you look at the total bed count in Alberta, it's 8,500 beds. And the only about 10% of those beds are being used. Now, at the time that I drafted the letter, in terms of the intensive care unit, there are 272 ICU beds, and about a third of them were being used at that time. It's up to about 50%, but I noticed between yesterday and today, it's dropped off by one. So in addition to that, as the Premier has said, that it is possible to escalate the number of ICU support type beds to 1,081, which fundamentally means that we're using maybe 12, 13% of the total potential ICU beds, So we really are not anywhere near overwhelming our capacity to handle the COVID-19 patients, which also brings up the point of the accuracy in diagnosis with many of them, but that's another subject.
Yep. No, I appreciate that, Dennis. And maybe again, because of time constraints here, we'll jump along. But number 2 and number 3 of your letter, you talk about how many of those patients are hospitalized with COVID-19, or how many are hospitalized due to COVID-19. And I think that this is something that it just seems like the health officials want to put that fear out there that people are in there due to COVID-19. And again, the number 3, you talked about how many died due to COVID-19 or with COVID-19. And so perhaps you want to just talk to the people tonight a little bit about what you're trying to emphasize there and what you're pointing out with this, whether it's due or with, because that really is important. And the numbers they give out, they won't ever tell us those things. And to me, I think that's critical. So maybe if you want to expand on that a little bit and tell people
Sure.
The problems there with those numbers.
Well, part of the difficulty has to do with the accuracy of the PCR test that is used to diagnose COVID-19. So as the CDC has pointed out very recently, that up to 50% of patients admitted with a diagnosis of COVID-19 are false positives. In other words, they don't have COVID-19. So the disease is overestimated from that particular perspective. Other studies have indicated that the PCR test may be indicating a false positive rate of up to 90%. But I would rely more on the CDC numbers. So what it means is that there is an overestimate in the patients hospitalized with COVID-19 or even diagnosed with COVID-19, because many of them who come into the emergency room are simply discharged and advised to go home and quarantine for a couple of weeks. So those people who come in with a serious illness, who are diagnosed as COVID-19, and if we assume the CDC data is correct and that a significant proportion of them don't really have COVID-19, and what it means is they have another illness that does require being looked after. And then on the flip side, there are those people who are false negatives, and that's perhaps a bit more worrisome, particularly if they come into the emergency room and they're symptomatic with a cough, and the PCR study does not indicate that they have COVID-19, but in fact, they do, and they're the type of individual that can spread the disease. So, but for the most part, people who are COVID-19 in the population don't have any symptoms. They don't even know that they have it. And the viral load is so low that they're really not spreading it. The key point here is, as far as dealing with the use of the PCR studies, is that it informs decisions about lockdowns that really are unnecessary. The virus is out there and it doesn't matter. There's so much data now that's just recent within the last few weeks. There's so much data out there that indicates that the genie's out of the bottle, that is the virus. And it doesn't matter whether you do a lockdown or you don't do a lockdown. The outcome is going to be exactly the same. The curves are going to be exactly the same. And we've seen that from multiple countries around the world. So it's the same problem with people who have died from COVID-19 as opposed to died with COVID-19. More nefarious is, particularly in the US, is the problem that patients who die and they have a diagnosis of COVID-19, they actually didn't die of that particular disease. They died of their underlying pancreatic cancer or heart disease or stroke, but they're coded as COVID-19, and there's a monetary reason for that, which is unfortunate. In our own system here, I don't know what the exact numbers are. That's why I asked the Premier to maybe share that data, if it is available. You know, how many people did die from COVID-19 as opposed to dying with some other problem, but they're coded as having had COVID-19 as a contributory factor.
Okay, well, I really appreciate that, and again, you know, like for me, and I think John Carpe with the Constitution, Justice for oh man, I can't believe JCC, that he put out some good articles, and the fact of the matter is we're averaging 2,000 deaths a month here in Alberta, and yet we're only focused on these so-called COVID deaths. We don't know whether it's with or because of, due to, and it's a real problem. And again, the fear mongering that goes on there. And I want to go back and say, you know, we should have a baseline, and okay, 2 Albertans died today with or due to COVID-19, but okay, what about the other 60? And I think that if we were to be given those numbers to realize that this isn't the only thing going on in the world, one of the things that you bring up here is how many deaths. And again, that's why I say if they actually told us every day, well, there was 16 opioid overdoses today. There was 4 died in a car accident. There was, and bring it into perspective so people realize the number of deaths that are actually happening, because it just seems like people are being indoctrinated, like everybody's fine except for these poor individuals with COVID and they're dying of it and we've got to save them. But can you comment a little bit on the number of deaths and again, how the province should be reporting that so that we kind of have a baseline and realize, okay, we're up double from those who died from influenza last year, or, it's up triple, quadruple. But what was it like 3 years ago? I talked to a paramedic this week and he says 3 years ago when they had a bad flu outbreak, he spent many of his shifts, the entire shift, sitting with his patient in the hallway of a hospital because there were no beds and they couldn't be admitted. And he says it's been great this year. He brings the people in, drops them off, and away he goes back on call. But perhaps you could expand on that a little bit, Dr. Modry.
Well, sure. Let's look at the average age of death in the population prior to 2020. So the average age of death was 82 for males and females combined, 79.2 for males, and the average age of death for females was 83.9. The average age of death for individuals with COVID-19 is 82. So there's been no impact in terms of in relation to COVID-19 causing a disproportionate number of deaths in a younger age group. This disease, as we know, tends to affect the elderly with 1, 2, or 3 comorbid conditions. And that's where the focus of our attention should be now, since the genie is already out of the bottle and young people are going to be able to weather the storm exceedingly well. As we know, if you're under 70, you've got a 99.995 chance of surviving. If you're over 70, you've got about a 98% chance of surviving. If you're over 80, you got about a 95% chance of surviving. Now, a really important point to make, people have said that early on in the course of COVID-19, as Dr. Fauci has said, and you can go back and listen to him, he indicated that the severity of COVID-19 was going to cause a logarithmically greater proportion of deaths than the seasonal flu. And he was indicating that the seasonal flu has a death rate of 0.1%. And he stated that COVID-19 had a death rate of 3 to 4%. Well, Dr. Bhattacharya from Stanford just recently on December the 9th testified in the Senate that the data that the CDC now has is that the death due to COVID-19 is 0.1%. It's identical to the seasonal flu. So what have we been told? I think there's a really important point to be made here. And that point is that in the medical profession, we often have preconceived views as to what is evidence. And a really good analogy of that is illustrated in a paper published in 1982. Prior to 1982, it was felt that peptic ulcers and gastritis was due to hyperacidity and stress. And in 1982, Robin Warren, a pathologist from Australia, and a fellow by the name of Barry Marshall, who was a microbiologist, they're both clinicians as well, reported in a paper, again published in 1982, that a bacteria which has since been determined or called Helicobacter pylori was actually the cause of gastritis and peptic ulcer disease in 80 to 90% of those who had it. Well, that was ignored for many years after. But in 2005, guess what? The two individuals were awarded the Nobel Prize in medicine. So what I'm really saying here is the medical profession is very careful about jumping to conclusions too quickly. A paper gets published and somebody says, that goes against conventional wisdom. Somebody else says, yeah, that does go against conventional wisdom, but I'm going to do another study to confirm it. And then after multiple studies confirm what the original study stated, then it becomes conventional wisdom. So you've gone from unconventional to conventional wisdom. In the case of COVID-19, we have learned so much since this all started in the West and in Europe. We've learned a tremendous amount. Different countries have done different things. What was conventional wisdom in the spring seems not to be conventional wisdom now. And so what I've been able to discern, because I've been very concerned about what's happening with the lockdowns, all of the unintended consequences of drug overdoses and suicides and people not being able to get their health care. Because I've been concerned about this, I've wondered, is there another path that should be followed? So I started examining what was being published going back to the spring and watching the evolution of how things have changed. And here's one example of how things have changed. I'm sure you've all seen on television physicians around the world slagging the use of hydroxychloroquine to treat or mitigate the symptoms of COVID-19. And just the other day, I think it was on December the 9th, the American Medical Association retracted their view not to use COVID-19. In other words, they're saying now, and this is from the American Medical Association, they're now saying that it's appropriate to use hydroxychloroquine. Well, that even surprised me because I was looking for, double-blind, randomized controlled trials. Having said that, that's what the American Medical Association, very prestigious organization, connected with NIH, the FDA, et cetera, said. So unconventional wisdom with hydroxychloroquine was dismissed as being a waste of time. Unconventional wisdom has now become conventional wisdom, according to the American Medical Association. And all I try to do with this letter is simply say to the Premier, who I have a great deal of respect for and know reasonably well, I like to call him a friend, but maybe we're more of an acquaintance, but we have had a number of meetings together. I really wanted him to take into account new evidence. I mean, that document that I drafted really has evidence from the last few weeks. And the latest, or the only article that goes back as far as October the 3rd was the Great Barrington Declaration, which in my estimation was quite brilliant, from luminaries from Stanford, Oxford, and Harvard, signed by over 50,000 vetted physicians and scientists around the world. So,
well, Dr. Modry, could we maybe jump into the ivermectin, and you and I watched, and again, because of technical things, we're not going to be able to show it, but Dr. Corey from California presented to the Senate this last week some just startling evidence about ivermectin, which is, again, like just what you're talking about with the hydrochloroquine, ivermectin. Do you want to expound a little bit on that? Because I don't want to run out of time here at the end of the show and not cover enough of these points. But what have you found about ivermectin and those people, the naysayers that, again, saying it's not acceptable?
Well, it was interesting listening to Dr. Corey, and I actually printed out his entire testimony. But what I found interesting was that, well, I digress for 1 second. The paper that I drafted, the open letter to the Premier that I drafted, did not include a comment on ivermectin. What I had reviewed previously in the literature was not compelling for me to include it. After I heard and actually I didn't listen to it, I read it. And then I looked at several of the references. Now, what he has stated, and like I said, I've looked at several of the references, is there were 20 clinical studies that were well-designed studies. 10 of them were randomized controlled trials. So that's what really got my interest. So when I see randomized controlled trials showing a treatment benefit, and that hasn't hit the FDA, the NIH, it really, I find it troubling. And you have to ask the question, why is this? Well, not dissimilar to hydroxychloroquine. Same thing with ivermectin. There isn't much money to be made with these because these are drugs that have been available for decades. So it raises the question. It raises the question: what's the motivation not to use these agents where there is compelling evidence to use them? And so I raised the question for our listeners. I raised the question in our in the open letter. And what I said in the letter was, I said there's gathering evidence. So there's gathering evidence, just like when they came up with the diagnosis of Helicobacter pylori as being the cause of gastritis and peptic ulcers, there was gathering evidence. So there is gathering evidence, and some of that, as far as I'm concerned, as a physician and as a research scientist, I thought that evidence, I believe that evidence was compelling. So that's my answer to the issue of ivermectin.
Okay, well, appreciate it. And I think what I found most profound, and Dr. Bhattacharya, I can never say his name right. It's kind of a mouthful for me, but both of them talked and I want to say publicly denounced, almost called them out, the FDA, the NIH, the CDC, because they didn't look at any drugs that could be repurposed. And Dr. Corey, in his very passionate testimony, said, historically, that's what we do, is that we go back and look at repurposed drugs, because it's amazing how many times they cross over. And like, those that are skeptic about ivermectin, well, how could this possibly work? But to my understanding, the experts first noticed it in some of the developing countries where people were taking ivermectin for parasitical control, and noticed that. And all of the great breakthroughs, I mean, it was the same with the Helicobacter pylori bacterium that people didn't realize it, but some person who's got, observant notices that. And it is very alarming to see the billions of dollars that are being spent and the cost. And I want to say that the sheer hope purely on the vaccination working, when some of these repurposed drugs look like they could be, just as high as efficacy, possibly as the vaccination. But do you want to comment a little bit on just this idea that we don't seem to be focused? And to me, that should be government's job. I totally understand why the pharmaceutical companies wouldn't want to say, hey, we think this old drug that's off patent is going to work. They're motivated to try and find a solution. But shouldn't government actually be focusing and have a task force that are looking at repurposed drugs? And it seems like the government are the ones that are dragging their feet the most. And those the extraordinary doctors and the experts in the field are just running into glass walls and doors trying to get in to tell the health officials that, look, here's some incredible trials that you need to look at. But what can you share about that with this, doctor?
Well, that's a good question, but let me respond this way. I'm not going to point fingers at governments for the way they have handled things thus far, because what was happening to a very large extent is they were acting on evidence that they believed, evidence that they were getting from, whether it's NIH, CDC, the FDA, in Canada, the Health Protection Branch, our public health officials, et cetera, et cetera. So I can understand why governments responded the way they did, and I can also understand why much of the public has a great fear of COVID-19. But what I've tried to do in this letter is explain to people, explain to the government that this is a problem that can be controlled, but it doesn't require lockdowns and social distancing and all of the restrictions that are currently in place. It just isn't gonna change the transmission curve at all. We've seen that. I've provided the evidence in the paper for that. But the real problem, of course, is look at all the businesses that have gone under, the people that have lost their jobs, and you know, the effects on crime and kids and suicides, drug overdose. I mean, this really touched me. You know, I made the comment in my letter, you know, as part of the Hippocratic Oath, first do no harm. And I believe that the government really felt that. Let's not do any harm. Let's contain COVID-19. This is what we think we should do. But in so doing, and I think you touched on it earlier, they threw out the pandemic rule book that indicated that lockdowns really don't work. They work in one sense. Like you take Ebola, that was contained in a small area in Central Africa, but that took an enormous effort to contain it in that one area. A lockdown for a virus, which now we're seeing that has a mortality rate that's comparable to the seasonal flu. I don't see the justification, you know, for these sorts of lockdowns. And I'm not sure, Paul, I've actually correctly answered your question, but.
Well, I'm because of time, I'm going to jump here and I'm going to answer one question, and then I'll ask you a question that we have here online. But to our understanding, that there is no benefit in Canada or here in Alberta to have someone coded as a COVID death. In the States, there is a premium that they get, but here in Canada, that isn't a motivation and shouldn't be a concern. But it does seem like they want to carry on the narrative of how scary this is the way I look at it. And I'm not quite as diplomatic, I guess, as Dr. Modry is. I actually do hold the government accountable. That they're so fearful of covering their own backside that they don't want to even allow the freedom of doctors to prescribe. You know, there was doctors here in Alberta that wanted to prescribe hydrochloroquine, and they literally got the letter from the College of Physicians that they weren't to do it. It's the same with ivermectin. And I just think that these professionals, when they're doing their research, are much more passionate about it and caring about their patients. And again, if you follow, and I'll put the link up on my website at paulhinman.com, but when you listen to Dr. Corey and he's watching his patients die every day, and he just says this is criminal that we're not treating them with ivermectin and setting up the trials to see it go by. But anyways, I just think that no, it is government's job to be gathering the information and sharing it and letting professionals make some decisions instead of saying, no, we should have been doing the trials. I mean, Dr. Modry, when you first came here to Alberta in 1985 and you set up that pilot project for heart and lungs, I mean, there's a lot of naysayers that we shouldn't be doing this. It costs too much. And, you know, what are going to be the losses? And if you just look at the negative side of that, as opposed to what your work and your life work has done and the lives that you've saved, to me, it's the same with this, is that we need innovative people. We need people that are wanting to risk. I mean, if you were to ask me, do I want to try ivermectin or do I want to try the vaccine? Sorry, I'm going to go with the ivermectin. It's got a long track record. The side effects are just nil compared to the unknown. But yet it seems like all these safety precautions were pulled out. But one of the questions here, Dr. Modry, is are you going to testify for the JCC in the court over this overreaction of the government? And maybe if you could just give a brief 1-minute answer on that, because we got some other things we want to discuss.
if I'm asked to do so in relation to what I've drafted in that letter, I would be pleased to do so because I think the evidence is there to justify everything that I've said.
I appreciate that. And again, you know, for me, and again, you talk here about school kids and colleges, and again, you're echoing the Great Barrington Declaration that we're doing more harm than good. The shutdowns for 97% of the population, we just know are going to have long-term effects on the mental health and the vulnerability, the learning curves on our children. There's just so many long-term effects that we don't know about. And again, my goal personally is to try, as you, to make Premier Kenney aware of these things and at least give Albertans the last week of the year to celebrate together. This isolation is wrong. There's going to be no benefits for those that are suffering with the COVID, but there's major harm being done that those that can't get together. But do you want to comment a little bit about the mental health, about people being able to get together to celebrate for Christmas? Do you feel that this is a viable option for Albertans, especially after a 10-day lockdown, that we can actually come together and celebrate Christmas as friends and family and loved ones?
Well, you know, I do actually feel that Mr. Kenney has an opportunity to give all Albertans a Christmas present and to permit those individuals who have other illnesses that need diagnostic studies and surgical or other types of hospital care to get that access. I am struck by you know, the couple of statistics, and one of them is the recognition that and the evidence is there, it's been published, that the deaths from lockdowns exceed the deaths from COVID-19. That really struck a nerve with me because I've spent my life trying to keep people alive. The other thing is the evidence that's percolating up now that the death rate from the seasonal flu is comparable to that of COVID-19. That was a surprise to me, just as it should be a surprise to all physicians that are, you know, that care about their patients, and I believe all physicians do care about their patients and want the very best for them. But I just don't understand the need for lockdowns. The evidence doesn't support it. There's no data to support that. And I think it would be a wonderful Christmas present to Albertans if Mr. Kenney did something unconventional, if you will, in terms of conventional wisdom. If he actually found some unconventional wisdom through the evidence that's been provided in this letter.
Well, really appreciate those comments. And again, I just don't think enough can be said on all the evidence that is out there now. And again, yes, when we go back to March 15th, that those were scary times. I mean, this was novel. We didn't know what was happening, and it was a real concern on what we should do. We've got a question here. And again, when I was reading some different articles, I think it's actually in the Wall Street Journal today saying that, look, you know, people that have had COVID, they don't need to be vaccinated. The US is going to be focusing the vaccination on the seniors and healthcare workers. But this individual wants to know if you think that you've had an exposure and not I guess a full out blown thing. He says, is there any way of getting tested to see if you've got immunity, or does one need to get the vaccine? But if you've been exposed to it, do those people need to be vaccinated in your opinion, Dr. Modry?
Well, it's been said that the very best vaccine for COVID-19 is to get COVID-19, particularly since the survival rate is exceptionally high. Having said that, the body's immune system does produce antibodies, and depending on the time following an exposure to COVID-19, someone who has it, who's been exposed, actually gets the virus. It either gets ill or doesn't get ill. A few months down the line, if they're tested and they've got antibodies, then they should be immune. If they're tested a year or 2 years down the line and there's no antibodies that can be identified, then you can, without getting into the issues of T cell memory and that sort of thing, it may be that they are still immunized, but it might be that they're not. So because we haven't got data in the long term, like a year or two out for people who have been exposed as to whether they're immune, I can't comment with fidelity, with certainty about that.
And wouldn't you agree though that those people that are prone to get influenza and the flu, they're the ones that often get it again the next year when it comes back? But we're really wrapping up here. It is coming to the top of the hour. I just can't thank you enough, Dr. Modry, especially with all of the technical challenges that we had here tonight. We're going to have you back on again. Dr. Modry, also one of the awards that he received was for a paper he wrote back, I don't know, I think it was 20 years ago in 1994. I can't remember the year now, but on fixing our healthcare system. And one of the things I think that we've learned the most about COVID-19 is that we're vulnerable. We've been running our healthcare system at 100% capacity. And if we actually have a pandemic, we don't have the field hospitals, we don't have the staff backed up. And again, Lieutenant Colonel David Redmond really talked about that we need to have those robust plans in place. And how are we going to do with it? But I just want to encourage everybody, please go to my website, paulhinman.com, and send those form letters or write your own letter to the Premier and to the MLAs and say, please, Premier, look at the evidence and realize that we're doing more harm than the virus, and give Albertans the last week to celebrate and come together. But I can't thank enough everybody for the patience and the sticking with us here. And again, hopefully the fourth time will get better. We had some things that we wanted to throw up on the screen, but because of the technical difficulties, I didn't even want to try and lose the connection. But again, thanks, Dr. Modry. Really appreciate the letter that you've sent to the Premier and I guess the movement that's going there. And again, the viewers, but take care and we'll see you. We're going to go again on the 23rd, next Wednesday at 7 o'clock, and hopefully things will go smoother then. But thanks and good night and God bless.